Welcome to familydoctor.expert. We're going to talk about the lovely topic of fungal nail infections. So almost every couple of days someone comes in and they've got very ugly looking toenails usually. Sometimes it can affect the nails on the hand. Thickened nails, crumbly nails, flaking. It usually starts off with just sort of a yellow patch, but it gradually grows. And people really want to get that sorted out. It occurs more often in older people or people who are working in a situation where they might have water, cleaners or cooks. Some young people who are often they're athletes or in communal showers will get fungal infections. Some people with certain diseases are at risk, anything that affects the immune system, diabetes or people who are on chemotherapy. Psoriasis, HIV, smokers have higher rates of fungal nail infections. So what your doctor will usually do is take a clipping of the nail and send it to the laboratory where they look for the little hyphae which confirms that it is a fungus. Now this helps the doctor because they're exactly sure what they're dealing with, and there's a few other possibilities. And in the case of Australia, when we ring up to get you the medication as an authority prescription, they want us to have done a nail clipping and to confirm the diagnosis because the medications are quite expensive, but the government actually subsidises the cost if you've got a proven fungal infection. So it's worth doing that. Usually after we take the nail clipping, you might have to wait a week or so to get the result, and then your doctor will get you back, ring up the authority prescription for you. Now, the usual medication that we use is called terbinafine, and it's 70 to 80% effective, but the thing about these tablets is you have to take them every day for 3 months. So pretty much if you look at the nail, the new nail has to grow for the entire period while you're taking the tablets, and gradually the fungal bit grows out. Having said that, the nail appearance doesn't always go back to normal, and sometimes you have to take the tablets even for longer. Now, those terbinafine tablets are pretty safe, though like all medications they can have side effects, and I'm not going to try and give you a complete list, and I recommend that you look at the product information, but just a couple of red flags. If you're taking the tablet and you have any allergic reactions, skin rashes, or if you're getting swollen glands or sore throats that persist, or fever or chills, or any signs of liver damage is another concern we have. So if your urine goes dark, or you've got tummy pains or nausea or vomiting, you should let your doctor know. But as I say, that's not a complete list. If you want to read the product information about terbinafine, it will tell you it in great detail. Now there are a couple of other treatments around. There's a nail lacquer. My experience is that doesn't always work, but some people get good results with it. For more extreme situations, we might get a surgeon involved if the nail's really deformed and needs to be removed. There's emerging treatments using laser and ultrasound that's currently being researched, and that seems to be effective for some people. Now, these fungal infections tend to come back. The infection in the nail actually comes usually from infection in the skin, and there's things you can do to try and reduce your chance of getting it. So I recommend if you've got some old footwear, get rid of it. The little fungal spores could still be in it. Keep your nails short, file the nails. If you're going to a swimming pool or you're an athlete where you're using communal showers, get some thongs, don't share towels. So I wish you well in getting your fungal nail infection sorted out. I'm Grant Blashki from familydoctor.expert.